Yes, thank you. So now we just see, now this is the nipple line. This is the mammillary gland or the mammary line. How to locate this point? From here you have to locate. From here you locate upward direction. Right. From here you locate upward direction. This point to be known as a, yes. Which point? Stomach 13. Stomach 13. Stomach 13, we just applied the stomach 13 point. That's called as a stomach 13 is located just inferior border of the clavicle. Now this also not much importance, but however coming points are slightly important. Please have a look. Now stomach 14, stomach 15, stomach 16 and then stomach 17. So now we try to find out the intercostal space. This muscles called as a pectoralis major muscles. This muscles called as a pectoralis major muscles. Now in this muscles the intercostalis nerves are passing inside to regulate the intercostalis muscles. Now we try to find out, the patient is complaining, I do have the pain on my chest region. Try to find out the pain is in the heart system or the pain is in the muscular system. The patient, if you touch and then feel, if the patient says, I have pain in the muscles, but not in the deeper level. Viscera pain is different. The muscular pain is different. The nerve pain is different. So therefore, you try to find out when you touch and then feel if the patient is getting some kind of the pain, that indicating the muscular pain. So if the inside of the pain is there, that's called as a cardiac pain. But however, let me see. So now this is the first identification location, that's called as a Ru Chung. Ru Chung means is the breast center. Now we just try, this is the fourth intercostal space. This located on the which region? Remember, this is the anatomical location. This located on the fourth intercostal space. Now just superior to that, this to be known as a third intercostal space. Then again you press and then go. This as a second intercostal space. Then again you can go, this to be known as a first intercostal space. Now we just apply first intercostal, second intercostal, third intercostal and then fourth intercostal. Now there are the 4 points located on this line. This is good point to treat for the chest related disorders, including the pulmonary system conditions, and also some people will get the pain on this region. Some people will get the pain on this region, especially GIT related disorders, also gastric related. Do you know the points are stomach meridian? Then you wanted to treat, you can use the stomach meridian point. I'll try to show you, but Manikanda, don't hesitate, don't get much pain, but be happy and it will get a sweet pain rather than this soreness. Okay, I'll show you in one needle how to insert the needle to connect to the one point, that is 1 to 1 point. Spirit. I just use as a superficially, yes. In this way, the needle can be connecting to the one point to other point, other point to other point. There are the 3 tune needle I just covered. By using the single point, we can cover, that's called as a through to through needling. Right, 3 tune needle inserted to the deeper level on the superficial level, because the cardiac viscera is existing on that region. That shouldn't touch to the cardiac system. Just superficially, I just applied horizontal level. So that will not cause much. Is this too much pain or how is it? Please tell to the audience. Mild. So in that way, the patient doesn't feel much pain if you insert it properly. So hopefully we connected the 3 points together rather than inserting one needle. Now these points are good point to treat for the motor points of the, remember, motor point of the pectoralis major muscles to be known as these points. That's called as a Kufang, Uyi, Ingxiang, Ruchung. So Kufang, Uyi, these are the points. And then Inchuang means is the breast window. Then the Ruchung is the breast center. Then the breast root, that to be known as a Rujan. Rujan is where exactly this point is located. On the one chun below, or the normally this region is the breast root, just distal to this on the fifth intercostal space the point is located. So now sir, what conditions normally we wanted to use it this point, whether we wanted to use it regularly or what? Remember, especially the women is more predominantly can treatable by using these points. Especially this can be applicable if you wanted to open as the aesthetic acupuncture center. In that way you can open and then treat only for the cosmetic related acupuncture, the facial cosmetic or the hip cosmetic or the thigh cosmetic or the elbow, that means is the muscle cosmetic, or you wanted to use as a breast cosmetic purpose, the sagging of the breast or underdeveloped breast or the overdeveloped breast or maybe the flaggy of the muscles. So these conditions you wanted to use as a regularly. So what direction you wanted to apply? So this direction you wanted to apply the needles. When you wanted to apply this direction you wanted to apply, or some conditions you wanted to apply this direction you wanted to apply on the downwards direction, or sometimes the upward direction, depend on the person to person or the condition to condition. We can use this or the specific point to treat. Even today in Mumbai, one of my friends, and also in Maharashtra, Nagpur, they are doing the cosmetic acupuncture to treat for the many celebrities. So therefore, many, even I had been to that place and actress came and taken the treatment. Even I have seen her that people how they are very fond to take up this medicine. No treatment without using any kind of the steroids. So normally can be applicable to use as a generally activation for the breast conditions. Now come to the 17th point we completed. 18th point we completed, that is on the Rujan Burang we completed, that's called as a Rujan, right? Now the Burang points, now we would like to see points, it get changes. Now where the points are located, fortune lateral to the midline. So far we have seen fortune lateral to the midline. We have seen the points are located here. How many points are located? 1, 2, 3, 4, 5, 6. 6 points we completed. 1, 2, 3, 4, 5, 6, 7. 7 points on the one line we completed on the stomach meridian. So we can do the cupping to this region. We can do the cupping. We can do the cupping to this region. You can do the one size or the two size cups. You have any kind of the problem or any lump or the cyst or the biretes, called as a breast imaging radio analytic data system. Normally today the mammography they do the women, so that time they have the biretes 1, 2, 3, 4, 5. Biretes 1, 2 is the safe. If the 3, 4, 5 means 4, 5 is there, perhaps that is the benign, perhaps they may have the malignancy as well. So therefore we should be very careful when we are treating to the breast related disorders, but make sure that if it is a malignancy, take the opinion of the oncologist and let they take the treatment. But however there is no biretes 1, 2 is there, so at that time of the 2 o'clock position or the 3 o'clock position or the 9 o'clock position or the 12 o'clock position, they do have the lump or the cyst. So there you just use that fibrocystic nodule. Normally we say if that nodule is there, that time you just activate, these are the local points are good. But you are talking about the stomach 17. Stomach 17, the point is stomach 17, the point is only for the location is anatomical location. You should not insert the needle to the nipple region. However, in the Chinese cosmetic centers, they insert the needle to the nipple region also. But however in Indian culture we don't apply the needle to the nipple directly, it's not advisable. That's called as a inhibitory point or the vulnerable point or the dangerous point or the prohibitory point to apply the needle on the nipple region, number 1. Number 2, it get differ to the person to person and female to female and the girl to girl or the woman to the girl, right? Normally before the marriage, so you wanted to anatomically location, you can locate properly that particular point. Yes, exactly, that is the located on the fourth intercostal space. The nipple is located as an anatomical location. Number two, when the married woman, maybe one child, two child, three children is there, so 4 5 children, that situation, the breast is not located on the fourth intercostal space, that having the hanging. So that situation you cannot make it. How to do that time? You have to lift totally like this. Once they lift to the upward direction, then where the nipple is located, that indicating that is the fourth intercostal space. When the person is like this or the woman is like this, then you are locating, yes, nipple is fourth. That is totally wrong. So hopefully you understand that is the fourth intercostal space. That is the root chung. Ru means is the breast, chung means is the center. So now that is the burang. Burang means is the breast root. That to be known as a, this is the root. Now I think I recommend you just please remove this needle. Press. How to withdraw the needle? Press to the muscles. Press to the muscles. Press to the muscles, then further you just slowly take out the needle. So don't remove like this needle and don't pull like this direction. Which direction the needle has been entered, in the same direction we need to withdraw the needle. So please you just lie down, Manikanda. Thank you. आप एक्टिवेट करते रहिए, दैट वुड बी बेटर. अलॉन्ग विद दैट जितना भी लंप और सिस्ट है, मैंने कुछ पॉइंट्स भी बताया. बिनाव, लार्ज इंटेस्टाइन 14, दूसरा फ्लम, ये एक सिस्ट है जो भी ये बायरेट्स पॉजिटिव है, तो ऐसे कंडीशन में दिस द इनसब्सटेंशियल फ्लम, वो एक फ्लम है, वो एक टॉक्सिन है, वो एक रिटेंशन हो गया, एक्यूमुलेशन, फिर उसको डिस्पेल करने के लिए आपको ब्लीड कीजिए. जिसका स्टमक मेरिडियन पे ये पॉइंट है, स्टमक मेरिडियन के आसपास से है, या फिर किडनी मेरिडियन पॉइंट पे ये है, तो किडनी मेरिडियन का एक पॉइंट होता है जो उसको ब्लीड कर सके. K1 को ब्लीड कीजिए, या स्टमक 45 को ब्लीड कीजिए, और स्टमक 40 आप लगाइए, तो फिर बिनाव LI 14 लगाइए. मैक्सिमम पीपल विल बी बेनिफिटेड. आप याद रखिए. तो इतना ब्रेस्ट रिलेटेड के लिए दूसरा बेहतर पॉइंट है. और स्टमक 41, स्टमक 40 तो है, स्टमक 41, और दूसरा सैंजो 5 एंड GB 41, ये पॉइंट्स. और SI 11 तियानजुंग, SI 11 इज द अपोजिट पॉइंट फॉर द ब्रेस्ट. तो ये पॉइंट्स को लगाकर हम ब्रेस्ट रिलेटेड डिसऑर्डर्स को सक्सेसफुली ट्रीटमेंट कर सकते हैं. नाउ वी विल सी दैट स्टमक 17, 18, देन 19. अब so you try to cover the entire spectrum of the region. You need to clean it, the entire region. Now we completed the Ruchen, then Ruchung, and then Rujan, and then Burang. From here, how many from the external? This is the siphisternum. What is this? This is the siphisternum. So you touch and feel. This is the sternum. This is the suprasternal fossa. This is the suprasternal fossa. Come to the sternum. Come to the sternum. Where the sternum get ends. This region to be known as a epigastric region. This region to be known as a epigastric region. So now try to find out. This is as a right hypochondrium. This is a left hypochondrium, and this is the epigastric region. This is the right lumbar region. This is the left lumbar region. This is the right iliac region. This is the left iliac region. This is the hypogastric region. The entire abdomen is divided into how many areas? 9 areas. 2 horizontal lines and 2 vertical lines. Two horizontal lines and 2 vertical lines. But this to be known as a right hypochondrium, where the liver and then gallbladder and the lungs are located. And then whereas in the right hypochondrium, what is existing? On the left hypochondrium is the spleen, and also there is the pancreas slightly in this region. Pancreas is located here, heart is located. Now come down, this is the epigastric region. From the epigastric region you can find the stomach, and then small intestine and large intestine. Small pods are existing over this region, and also pancreas are existing in this region. Then the right lumbar region, then the left lumbar region. This is the below the navel. Below the navel, this region to be known as a hypogastric region. This is the epigastric region. This is the hypogastric region. This is the right iliac region. This is the left iliac region. So now we are talking about the epigastric region. Now we are talking about the epigastric region. You press the sternum and then come down. Once you press and then come down, so normally patient says I do, when they press, they says I do have the pain, that's called as epigastric pain. So epigastric pain is indicating perhaps it is related to the stomach or it is related to the heart as well, right? Because this region, the patient says I have the burning sensation. Burning is related to the stomach, at the same time it is related to the heart as well, right? Because when the cardiac arrest or maybe sometimes the myocardial infarction or the heart attack ಆಗ್ತಾ ಇತ್ತು ಅಂತ ಸಂದರ್ಭದಲ್ಲಿ ಇಲ್ಲಿ ಬಂದು ಬರ್ನಿಂಗ್ ಸೆನ್ಸೇಷನ್ ಇಲ್ಲ, ಬರ್ನಿಂಗ್ ಅನ್ನೋದು ಹೊಟ್ಟೆ ಬರ್ನಿಂಗ್ ಒಂದೇ ಇರುತ್ತೆ, ಅದಕ್ಕೋಸ್ಕರ ನಮಗೆ ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಜಾಸ್ತಿ ಆಗ್ಬಿಟ್ಟು ಅಲ್ಸರ್ ತರ ಆಗಿ ಉರಿ ಆಗುತ್ತೆ ಅಂದ್ಬಿಟ್ಟು ಹೇಳ್ತೀವಿ. ಬಟ್ ಅದು ಉರಿ ಕಾರ್ಡಿಯಾಕ್ ರಿಲೇಟೆಡ್, ಹೃದಯ ಸಂಬಂಧಪಟ್ಟ ಕೂಡ ಕಾರಣಕ್ಕೋಸ್ಕರ ಉರಿ ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಬಟ್ ನಾವು ವಿ ಟ್ರೈ ಟು ಫೈಂಡ್ ಔಟ್ ದ ಎಪಿಗ್ಯಾಸ್ಟ್ರಿಕ್ ರೀಜನ್. From the epigastric region, from here to here, how many chun? Marker. How many chun? This always the proportional measurement in your tip of your tongue. This is 8 exactly. Yeah, from here to here, how many chun? 8 chun. So now the point is located 6 chun proximal to the. Remember 6 chun. From here to here, how many chun? 8 chun. But now this is 4. But you measure like this 3 chun. See, it get differs. That's the reason we always remember there is the proportional measurement. From here to here is 8 chun. But now this is as a 4 chun. Right? From here to here is, this is half. That means this is the 6 chun. 6 chun. Right iliac, left iliac and also hypogastric region. We try to cover this region. Now we can see, yeah, this you just take out this enough, yeah. This enough, Manikanda. Now we can apply, there are the don't worry. Limitation is only this much. Right. So 1, 2, 3, 4, 5.
He must be thinking what has given today.
Wailing tacho, shoitao, kulai, chichong, pekwan. So now the points are 5 points we'll see now. So one is the wailing tacho and then shoitao. So these are the name itself, it's giving some kind of the information. Now you remember the 1, 2, 3, 4, 5. So do you know the pubic symphysis? Pubic symphysis is the hairline. Yeah, now you can see the hairline. Hairline is where the hairs starts, especially for the male and then female. That's to indication that recognize that the pubic symphysis. Pubic symphysis means is the bone, right? Bone. You can touch and then feel that is the bone. But how to recognize that bone rather than touch and feeling? We can find out the pubic hairs. When the hairs where it starts, that area to be known as a pubic symphysis area, right? Now from there you can divide it into 5 segments. From the Tianshu, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Now these are the 5 points we just applied to treat for the what condition? For all the gonads related problem and also male and female related pelvic related disorders. Now let me see, these are the points are wailing tachu is the local point to treat for the small intestine. But this area is the small intestine and also urinary bladder and also the para orb of the uterus, ovaries and cyst and also testicles are located below this region. So below any related problem, certainly we can focus to treat this region, wailing tachu, shwedav. Shwedav is the water passages. That means anything is the retention, water is not there or the water get excessiveness. That condition we can use this point. Then further is the kulai is the most important, I told you long time. That is stomach 29 is the kulai means is the return. That means is the any kind of the power, any kind of the sexual activity of the male and then female. Both the conditions we can treat by using this point. Just lateral to one chun, this point to be known as a zigung. Zigung, Zigong. Zigung means, Zigung means is the palace of the child or the palace of the uterus. Uterus related conditions, we can use this point. Yeah, ovaries is good. The PCOS, PCOD problem. If the right side having the problem, left side having the problem. See, male, we cannot open and then apply all the needles.
Overbreeding scenario. So the generally women is having the PCOS or the PCOD problem. So the moment they're having, they might be a scenario of the overbreeding also.
Yes, excess.
So that's an answer.
Yeah, menorrhea means excessive bleeding condition. Is in that situation also advisable to use this specific points are advisable to activate. This is the stomach 29 and then one tune lateral to the stomach 29. Both the points are really bilaterally, you can use it. 2 plus 2 4 points are good point to treat for the all the male and then female pelvic related disorders. If you can do the moxibustion, excess bleeding is there it's not advisable the moxibustion. Otherwise you can having the cyst or the fibroid, even that condition. The what is that? That's nothing but cyst is nothing but is the water. The fibroid is the solid water. This the semi-solid is the cyst. So therefore the height, more predominantly is the fibroid. So these two conditions also can be advisable to use the moxibustion. These both the regions are good. Every day need to be done. Every day need to be done. That is slowly going to dissolve, may not be required the laser or something like that. Ask them to reduce the weight and then definitely have the positive impact. Every day they need to walk for 30 to 40 minutes are advisable. Now the Chi Chung is the stomach 30. Stomach 30 points is great point to treat. That also for the stomach 30 and then stomach 31. Both the points are good point to treat for the, especially for the gonads. Especially for the gonads. Male and then female gonads can be treatable by active ovaries and then is the testicles can be treatable by activating stomach 30 point is good. But make sure whenever you wanted to apply these points, the bladder is empty. You just make sure the bladder always should empty once you insert the needle. That always is good. When the bladder is not empty, you cannot insert the deeper level, is not advisable over this region. However, I recommend you use only the half tune needle rather than using the one tune needle. Is strictly not advisable. This area, remember, is the very, very key point to all of you. Whenever we wanted to apply to the very deeper level, you use the 1.5 tune needle on this region perpendicularly. You will going to damage to the peritoneal cavity, but it's not advisable. Once you touches the peritoneal cavity, that performa, that's called as a hole will going to happen. Through that the hematoma, that means is the bleeding or some kind of the stagnation of the blood, chances are there to develop. So that's the reason apply the superficially. If the person is very, very obesity, that time you can use one tune. When the person is like this, you just apply the half tune is advisable. Right, now we completed stomach 30.